Good evening. Follow up on what we said a few minutes ago. Once you complete your radiation or chemotherapy or surgical treatment, you must be followed up. Number one, to make sure the cancer is not coming back, and if it come back, which usually not common, it will be salvaged with treatment, so your chance of cure will be high, and that's true in a big number of cancer cases. You need to understand, if you used to smoke and drink and your cancer caused or associated with smoking and drinking, in this case you must stop smoking and drinking. Otherwise, there is high chance of your cancer or similar cancer come back in the same area. For example, those patients with head and neck cancer, majority of those patients are smoker and drinker. They drink alcohol, and those patients, once the treatment is completed, they must refrain from smoking and drinking, and they must avoid smoking and avoid second-hand smoking and so on. The chance of getting a second cancer for those who continue to smoke and drink, about 20 to 25% in the aerodigestive tract, means the neck and chest cancers. So it's very, very important. You must stop smoking and drinking after you treated because a second cancer could come, and that could be more aggressive, and you will not be cured. Follow up closely with your cancer specialist, especially those completed your treatment. Number two, refrain from smoking if you used to be a smoker. Refrain from alcohol if you used to be a drinker. Number three, go for healthy lifestyle at all levels. I'm going to take a step further for those patients treated with cancer and successfully, and they already live normal among us, and they deal with every scenario in life like us. Those patients already had experience. A majority of them, they do well, and they feel this experience, they took it easy, and they thank God they are cured, and we call them cancer survivors. And those, they do well, and majority of them, God willing, the cancer does not come back. And if the cancer come back, there is always we need to make sure it is cancer, and if it is cancer, then what are the treatment and so on. It has to do with type of cancer, what treatment, and so on. Patients need not to get confused. Big percentage of patients, they hear their colleague and they get confusion. For example, patient with prostate cancer, not all of them, they are the same. Prostate cancer could be 80 or 100 scenario, and each one is different. So your treatment could be different from another patient who's prostate cancer. Why is that? Because prostate cancer stages, and each stage could have absolutely different treatment than other stages. So even though both of you have prostate cancer, but your friend treatment is totally different from your treatment. Your follow-up is totally different from your friend. So do not listen to your friend who has cancer of the same type like you, prostate, and he got different way of treatment than you. Also in follow-up, you need to make sure you stick with what your doctor say, and your friend who have the same cancer will be different because he is different stage, his age is different, his all variables are different. Some patients with prostate cancer, they treated with radiation only. Some could go for surgery. Others will need hormone therapy. Still other will get combination of the above. Some will get no treatment. Some will get treatment out of the prostate, and so on. So there are many scenarios. So each patient is different. Treatment is different. Follow-up is different. So it's so important to get advice from your doctor and not from non-physician in the community, because I am bringing that because that's so important. Patients many times get confused. Sometimes they wondering what's happening because their colleague have the same type of cancer, but they are treated differently. You need also to understand you cannot compare apples to oranges, because everyone is at different level, different stage, and different treatment, even though it is the same type of cancer. Also, you are different from your friend. So the cancer is a factor, stage, extent, and so on. The other factor is you. You are different from your friend. Your friend could get treatment X, Y, Z. You cannot get treatment X, Y, Z because of you, your system, your strength, your age, your comorbidity, and so on. So cancer is one factor, patient is another factor, and also lifestyle is a third factor. So you will see different options for different patients. For example, elderly patients with prostate cancer, sometimes they do and they want radiation treatment. Within radiation there is seed implant, a radiation from outside, we call it external beam, IMRT, cone beam is getting so sophisticated. Then you have now high dose rate brachytherapy where catheters inserted into the prostate and so on. Within radiation there are many options already. So those elderly patients, even though the same stage as younger patient, they might only want the treatment from outside, external beam. They might not be interested in seed implant or brachytherapy using catheters into the prostate. Even though they have, but age is a factor here. Younger people want to get all benefit of the doubt. They don't care if the treatment is a little bit hard here or there, but they wanted to do that, and we offer that to them. So everyone is different. Older, different than younger, stage of cancer, and so on. So do only listen to your doctor on your case.